Alan, new state health data being analyzed tonight by the I-Team is not encouraging. In the most recent one-week period, these new figures reveal that more than 3/4 of all Illinois COVID deaths occurred in nursing homes and long-term care facilities.
Nursing homes continue to be a challenge. There isn't an easy answer. People think that, well, gee, if you know there's a problem, why can't you just solve it?
New data available tonight maps out the increasing challenge. Illinois nursing home and long-term care facilities now report more than 3,100 coronavirus deaths. That is 54% of the state total and growing by the day. And elderly infirm facilities in the 8 counties that make up Metro Chicago are approaching half of all COVID deaths in the entire state. With that new data in hand, the I-Team today asked Governor Pritzker if his original statewide stay-at-home order would have been more focused had he known nursing facilities were going to have more than half of the state's deaths.
I think it's a false premise for the question, to be honest with you. The fact is that the stay-at-home order was designed also to save and to keep healthy the rest of the population, because it's not like it's limited to nursing homes. It just happens that in very, tight congregate settings, and we know this from our prisons, our long-term care facilities that deal with non-seniors, and then of course our nursing homes, that those are the most difficult of the circumstances. But I think you saw that we brought down and kept down that curve.
Regardless of the coronavirus curve coming down tonight, very disappointing news from Governor Pritzker for the families of more than 100,000 residents at long-term care facilities. He says they are not opening up nursing homes for visitors. He did not provide a date for removing the hard lockdown. In view of the data the I-Team has shown you tonight, the governor said at nursing homes, the less direct interaction, the better. Alan?
Hey, if you like that video, be sure to subscribe to our ABC7 Chicago YouTube channel.